And I'm going to move now from you to my incredible panel here. One still with you on the Zoom, but I want to start with Dr. Hania Sholkamy, who is actually one of the designers of the program itself, and she has done her own assessment. So here you go, please.
Thank you, Abla, and thank you, Dr. Scott. I'll start in English because I'll speak directly to some of the points made, and then I'll turn to Arabic. But first, I can say this because Abla is one of my dearest friends. You know what they say about women of a certain age disappearing? So that's why my bio disappeared. No. In any case, Scott, can you hear us? Okay. So, a few points about the IFPRI study. The first is about this business of eligibility and recruitment. I think one thing that the IFPRI study does not say is that these Karama and Takaful are programs to which people have migrated from existing social protection and social pension schemes. So they are not outside the programs. They were migrating to the programs. And initially, in designing the programs, we had set up a real RCT where we were offering Karama and Takaful as an option vis-a-vis existing government-provided social pensions. This was a randomization of 32 villages in Asyut and Sohag, and we collected the baseline. Unfortunately, or fortunately, we had a revolution, so the programs were discontinued. So that's one thing to say about recruitment and who's eligible and who's not. The second is to say that the validity of a lot of this data comes into doubt because Karama and Takaful are government-provided programs, and we have a very restrictive, autocratic regime that does not enable the collection of social data by any other than a government program. So anyone in the program knows that whoever is coming to ask them about the impact of this program is linked to the provider. This is a flaw, a very severe flaw in the governance of these programs. The provider is the evaluator. Even if the World Bank is funding IFPRI to evaluate the program, but you do not have freedom of information or freedom to be an independent assessor. So this is the second thing to mention about these programs. The third thing and final, and I'm not going to take long because we have a much more esteemed panel, is this result on gender. And this is a study that myself and Professor Naila Kabir conducted in 2022 to do an alternative gender impact assessment about the effect of Karama and Takaful. What is missing from the IFPRI tool, let's say, is any sense of cultural meaning and cultural interpretation. Why fruit? What does fruit mean? What does meat mean? When do you eat this? When do you eat that? And this is from our study, which is soon published, at least in one peer-reviewed journal, this issue of women's decision-making in the household, a bizarre indicator, because it's one of those indicators that assumes that when women have access to resources, they will participate in decisions, but more importantly, they will make the right decision. This is a very American sense of, when you do the right thing, you do it all the time. You select rightly. Well, our gender tool was based on data collection with women who are not just at the 4.5 cutoff, but much lower and much higher, to understand the cultural meaning of this money. Because yes, money is fungible, but where it comes from, what it means, what kind of empowerment effects That's the third thing I wanted to say. So the IFRI study has contextual problems. Finally, there's also very weak differentiation between eligible and non-eligible, because some of the people in this sample are no longer taking Karama and Takaful, but they were 2 months before the data collection. And some of them were in the program and deselected from the program for reasons they don't understand. Some people have applied and are waiting to hear, so they are also, so that like contaminates. So this differentiation between who is in and who's out at this 4.5 cutoff is also weak, and I think that we need to have a decomposition of this sample to see who has applied and not gotten it, who was in it and was left, who was in it and was kicked out and returned to the program. Some people in the sample, and Dr. Heba, of course, is in the audience and knows, were in it for less than 2 months before they returned to the program. So there is real contamination between eligible and non-eligible. I'll stop here and switch to Arabic just to say one thing.
What I would like to say in Arabic is the following. Diving deeply in the statistic information and in the statistic data, we make us forget what is the aim of these programs. It's very important to look for the impact, very important to look for the results, very important to have based evidence of the impact, very important to know every single pound, every 10 pounds, what did it achieve. But here we are talking about social justice and not social protection. Therefore, the impact, the assessment of the impact, we need to have a comprehensive vision on this programs, what are the achievements of these programs, and what are the obstacles in front of the program. So thank you so much. Oh, thank you so much, Dr. Hania. And I apologize that this paper fall down from me. Sorry. Your comment actually is very much appreciated. And I didn't know that they are people that they were excluded and then they were back again to the program. The question is, when they are back, was it in the same amount, in the same value of their first participation? And we need to do an assessment to know if they were not excluded, what is the amount that they will get. And the idea that of gathering the information is done by the provider and the assessor. The assessor is he himself the provider. It is the same issue of the eligible and the eligible. And unfortunately, the statistics make us forget what is the aim of this program. Now we are going to move to the 4 donors agencies here. I'm going to start with our friend on Zoom, Marcus Holmlund.
Marcus Holmlund, representing the World Bank, DIME, which is Scott, please stay with us, because we're going to come back again. Represent. Hi, hello, Marcus. Yes, you are coming in loud and clear. So tell us how do you guys assess social programs in the case of Egypt, and whether you have done any work on Takaful and Karama go ahead.
Yeah, wonderful. Thank you so much, Dr. Abla. I'm going to speak in English because I don't speak Arabic yet.
I'm surprised.
I hope to one day.
I'm terribly surprised.
One can always, there's always more to learn, right? But I just want to start by saying, on behalf of the development impact, or the DIME group at the World Bank, sincere thanks for inviting us to be a part of this discussion. So thanks to ECES, to you, Dr. Abla, for hosting us. Dr. Scott for the great primer on causal inference, as well as the sort of detailed analysis of the IFPRI quantitative impact evaluation report. I thought that was very interesting. And I also really appreciated the comments by Dr. Hania about sort of the right cultural interpretation, the right meaning of some of the quantitative findings. and also, you know, being very clear in defining the impact that we're actually looking for. So I sort of love this type of discussion where you have you know, program designers, policymakers, academics, evaluators, kind of all putting their minds together to really think about what does it mean to evaluate a program, and what do specific results mean. So I'm representing our director, Ariana Legovini, today. Unfortunately, she cannot be with us. She's in transit, but she sends her apologies and wishes that she could have joined us. So I'm going to start by just, you know, saying something that I hope that many of you will agree with, even though maybe it sounds a little bit controversial. And that's really that, you know, the way that we've traditionally approached the design and the management of humanitarian and development programs, it's really not up to today's challenges, right? So if we think about, you know, the most successful for-profit private sector companies, they use a flurry of data, of analytics to inform their decisions. Whereas in development, in humanitarian work, we're still very often stuck in kind of this central planning mindset. And what makes this even worse, I think, is that when it comes to projects, we often work in isolation, even within our own organizations. And so there's little cross-fertilization across teams, even when our work is highly related. So this is sort of a little bit like, you know, we plant 1,000 flowers in a field, we hope that some will bloom. It's clearly not the best way to go about things. We usually sort of favor these preset designs that are fully decided on in advance of implementation. And if we're honest with ourselves, like there's really not much meaningful adaptation. There's not much use of real-time information in most programs still today. And so I think the unspoken assumption that we're making here is that, you know, we got everything right when we designed the program, but that's really, it's not so likely. Right? And finally, you know, the evaluation, if there's a serious evaluation done at all, and I think, you know, a lot of credit to the Takaful and Karama program for engaging in a very serious evaluation exercise. If and when this is done, though, it's often kind of an afterthought, and it's often thought of as being functionally separate from design and delivery. And again, the way that we sort of approach things within the World Bank at DIME, you know, we think that this is a little bit of a weakness. And so the end result of all of this is that we have inefficient projects that perform well below their potential. So our group, Development Impact, DIME, exists because we really think we can do better, right? We think we could do much better. So we're a research department that works hand in hand with governments, with other partners, to use what we call our trial and adopt impact evaluation technology to maximize the effectiveness of development finance to get better results. And we call this a technology because it applies a scientific, a rigorous, a systematic process to resolving development challenges. And this is not only related to the methods, but to the process through which those methods are applied, right? So we begin with investing in data. And this is critical, right? We need to know in what we're investing and where to invest. So just one quick example, in Nairobi, we were able to identify through a combination of Twitter data from Google Maps, police reports, surveys. We were able to identify the 1% of road segments that are responsible for 50% of deaths, right? And this, of course, makes something like addressing road safety sort of much more tractable. So data is first. Second, we work with our partners to trial ideas, to trial alternative design options in the context of projects so that those that work best in practice can be adopted for greater impact. So this goes sort of beyond that question of, is the program effective, to how do you make the program its most effective version? And so the work is often guided and it's motivated by economic theory, but then we use trials as well as some of the other methods that Dr. Scott was mentioning to empirically validate hypotheses and decisions on program policy design. Third, we work programmatically across countries and sectors to really mainstream learning as a key part of development finance and policy. And fourth, we don't do this in isolation, right? We do this in partnership with our research, our policy, our operational partners in country. I want to recognize also my colleague, Nala Zaytoun, who is the task team leader for this program, who is, I think, joining us online as well. So we work very closely with our operational colleagues and with other partners so that we can, you know, bring in the right expertise, strengthen the capacity to manage for impact, build globally relevant knowledge. And so what we see is that such an approach really results in more efficient and more effective projects with greater impact. So how much greater, right? Well, we've been developing our approach or our technology again over 20 years, and we've applied this to more than 160 projects. And so we find that kind of very, very small investments in this forward-looking trial and adopt impact evaluation can increase our overall impacts by large margins, 50% or more. And so this is kind of remarkable, right? This suggests that in many cases, we are leaving development impact on the table. And yet conceptually, it's very simple, right? It's really about applying a scientific process to test what works, and then to understand how to make each program, each policy, and in each intervention the best version of itself. So this is something that we're now scaling up within the bank as part of our evolution roadmap that's being spearheaded by our new president. And it's also done in collaboration with other multilaterals, bilaterals, philanthropic organizations like the World Food Program, the EU, the Norwegian Development Agency, the Bill and Melinda Gates Foundation, and so on. So that's a little bit of an overview of sort of how we approach things in a systematic and programmatic way to really try to not only measure but actually amplify the increase of development projects. When it comes to Takaful and Karama specifically, I think we should recognize the team and IFPRI for conducting this evaluation using a very rigorous method that they could apply given the conditions that they were faced with in terms of data availability and things of this nature. And also there was I understand a qualitative component, which I think is a great value added as well. And so what we see is results that are, broadly consistent with what we have from other studies of unconditional and conditional cash transfers, decreases in poverty, increases in food consumption, this pretty dramatic improvement in nutrition status, and so on. And then, of course, some mixed results, and that's also not surprising. I also think it's really important to recognize that this program had a perspective beyond cash transfers, if I understand correctly. So sort of looking beyond the immediate cash transfer towards more of an economic inclusion type approach, and then the linking of this program with other social services. So I think there's a lot of very promising design features. And so we haven't conducted work on the Takaful and Karama program specifically, but we do have good evidence globally on the potential of cash transfers and of cash plus programs, such as economic inclusion programs, for example, as potential tools in tackling poverty and other development challenges.
Marcus, you have like 1 minute to go, huh?
I have 1 minute. Okay, cool.
Yes.
I will try to finish within 1 minute. So I think great. So we have a good amount of evidence about these programs. I won't go into some of the examples that I thought I might cover, but I think the important thing to say here, and the important thing to understand and to convey, is that these programs are really not handouts, right? So even unconditional cash transfers have been shown to be sort of highly cost effective with a broad range of effects that are persistent. When combined with CCTs specifically, they become this potent combination that can tackle, both poverty reduction and also complementary goals like human capital accumulation. And then if we think about sort of cash plus type approaches that layer things on top of basic cash transfers, such as economic inclusion programs, kind of multifaceted interventions, we really see dramatic potential in transforming the lives of the extreme poor and putting them on a productive path to lift themselves out of poverty. In settings like Afghanistan, right? Very difficult settings, seeing 20 percentage point decreases in extreme poverty persistent over 5 years. So we have good evidence on the effectiveness of programs like Takaful and Karama. We need to know more, right? We need to know more about how these programs should be designed for specific populations and what the impacts are across those populations. We need to understand more about how to design complementary interventions and packages, and really how to deliver these at scale, right? So we have 700 million extremely poor persons living in the world today. These are promising interventions. How can we design them in a way which is fiscally feasible and for which we have the kind of implementation capacity? So I think I will stop there. I mean, these are the kinds of questions that we are addressing in our social protection and jobs program as well, and I love discussing them with you all. But I'll stop there and hand it back to you, Abla. Thank you so much.
Thank you so much.
Thank you. I was hoping to hear more about, the efforts in Egypt. All right. But what you mentioned about what you are all doing in social programs in other countries is not difficult. It's not different from the problems you're having, are not different from the problems that we're having. That you're almost assuming that the program must be good, okay, basically, that there is a data issue, and that we're all after how to make programs most effective. Okay, let me move on now to Lina Nabarawy, UNICEF Egypt. Okay.
Thank you so much. Okay, thank you so much, Dr. Abla, for the invitation. I'm very excited to be also with the distinguished panel.
Can you hear her?
Colleagues and friends. Can you hear me? أحسن كده؟ Okay, طيب. خليني معلش هتكلم بالإنجليزي. And Dr. Abla, if you would allow me, I'm also going to be talking not as an expert on evaluation methodologies, but actually as a data user, as someone that works with evaluators to inform our programming and make the service delivery much better. So maybe to start with, I'll start with a few thoughts and reflections on the presentation, and then I can go into a more generic comments that is related to the linkage between social protection and other services and how it can build on the evaluations. So, Dr. Scott, in your last slide, you've mentioned something that is quite interesting, which is machine learning and the use of AI tools. Now, we know that there has been a lot of evidence on using machine learning and econometrics, and I think it would be interesting to learn more on this. How can a decision maker, a policy maker sitting at his office, make the best use of the data that they are collecting? We always push for more evidence, we always push for more data and more analyses. However, we also have a wealth of information in the country. If we are talking specifically on social protection, on takaful and karama, the Ministry of Social Solidarity, they are collecting data for beneficiaries from enrollment to programmatic monitoring, from the IFPRI evaluations, but also beyond social protection on other programs that are delivered by the Ministry of Social Solidarity and beyond that targets vulnerable populations. And when we even say vulnerable populations, you would find that most of the beneficiaries are actually beneficiaries of cash assistance programs. So how can we support policy and decision making to make the best use of the admin data available and possibly use machine learning, AI tools, and econometrics for them to be able to draw recommendations or estimate the impact of a specific intervention on different population groups? My second question is also maybe related to, it's actually not a question, but I liked also that you've mentioned that the IFPRI paper was quite long, because then I think that it happens to us all of the time, is that sometimes the discussions that we are having are very, very technical, and then there's sort of a gap between the evidence and data generation and policy and decision making in the country. So I'm a very strong advocate that we need to also simplify the language as much as possible that we are using. It's very good to be technically strong and technically sound, but also it could be a development of a series of policy papers which we have seen very useful in other thematic areas that we have been discussing. And then more basically broadly on the linkages between social protection and other services. So we've seen the expansion of the Takaful and Karama program from 2015 with a few hundred or a few thousand families to almost 5 million households. And I think the Ministry of Social Solidarity has been advocating a lot on this horizontal expansion, adding more people in the program, but also the vertical expansion with what we've seen, the 25% increase in the benefit level. But maybe it is also time that we start systematically reviewing the benefit level, because with the recent economic situation that the country is going through, with inflation at 40% and food inflation at 70%, this is very concerning. It is also very concerning for me representing UNICEF, as we see that this might have probably a damaging or irreversible damage on the nutrition and well-being of children, specifically those at the age of 2. We're talking about negative coping strategies, reducing food consumptions, reducing the consumption of meat, chicken, fish, milk, eggs. These are crucial for the well-being of children. So also maybe a discussion around systematically reducing the benefit levels so that they are coping with this loss in the purchasing power of vulnerable families receiving cash assistance. And then also building on that, the situation is constantly changing. And Dr. Hania, you've mentioned that it's important to look also beyond the evaluations on the goal itself. So I think in addition to the evaluations, which is very much needed, we need to continue monitoring the situation of these families. Something that is quick, it might not be as rigorous as an RCT, however, it is still very indicative, and it can help us take corrective action and to see also the negative coping strategy if there are any with every economic shock that these families are going through. Cash Plus, Marcus, you've already mentioned this, but also if we are to evaluate and if we are to look at the previous IFPRI evaluation, it's very interesting to see cash alone versus cash plus other services. There is global evidence, but from evidence in Egypt, there's nothing that says that basically if you are delivering cash to a specific family versus if you are delivering cash in addition to a comprehensive set of services, but also understanding what is the best package of services that we are able to deliver, which takes me to my last point, is on whatever we are discussing today, it comes at a cost. And we are working with limited fiscal space given the economic situation. So we also need to be very mindful. And in addition to the recommendations, evaluation, advocacy messages that we are pushing, then we need also to calculate how much is going to cost. If we can do investment cases or do fiscal space analyses, see how can we improve public budget efficiency. And this is also where evaluations come in handy to let us know what works, what does not work, but also what is the most effective and efficient intervention. Because if I'm sitting at the Ministry of Finance and if I had to pick what is the best investment to make, I need to make the one that is most effective, but also the one that is most cost efficient. Let me stop here and thank you again so much for the invitation.
Thank you, Lina. Very well said. Let me just mention something very important in your comment when you said that you questioned how we can use artificial intelligence in order to make proper decisions for policy makers. We are doing exactly this at ECS, okay, at the level of job, knowing the jobs that exist, the demand for jobs using AI, okay, and making conclusions and passing those messages to the policy making. The main reason why we're having this seminar is because we want to do something similar with the programs to better assess them, and hopefully with UNICEF and with the Ministry of Social Solidarity we can make a difference. The amount of money that the families take is very small, okay, and with inflation it gets even smaller, and so it's a big concern if it's a good idea to continue with this, or it should take another shape. But definitely a deeper assessment is needed, at least to recognize the problems and make corrective action. Okay, now Dr. Heba, Wafa.
شكرا دكتورة عبلة والمنصة الكريمة. أنا هتكلم بالعربي.
Let me start And let me start from where you end, Dr. Abla. And let me ask Mr. Scott, what if there is no takaful and karama? If we said the question in this way, what if there is no takaful and karama? And we have this money that we spent on the program. If takaful and karama doesn't exist, will this negatively impact the social justice that you are talking about? Or we can take this money and buy medicine, for example, for the children that they need medicine in the hospitals, or to buy things, other things that we need. You see that the country here, we need support in many fields, like, for example, the support in the health sector. So is this study can help us to answer this question or not? This is my comment. Then I'm going to comment of what Lina said, and I'm going to talk about cash plus other services, and I'm going to talk about the UNODP working with the Ministry of Social Solidarity, which is the social awareness why program. It's specialized. We are addressing the whole community, the whole society, but we address more the beneficiaries of takaful and karama. We are talking here about 12 issues, 12 subjects, 12 very important issues. So that we might start with it, that we can talk with the beneficiaries with, in order to reach real changes in the ideas, in the mindset, in the behavior that might be translated into solutions to solve specific problems. If we are talking about education, health, the mother and child health,
early detection of disability, health and hygiene, prevention of drug abuse and control, positive parenting, female genital mutilation, child marriage, citizenship, and combating of illegal migration. We have chosen those 12 social protection issues, and we had very clear messages and very clear ways of targeting the beneficiaries and communicating those messages to them, so that we can achieve the real behavioral change for takaful and karama beneficiaries. The way we do that is that we don't only target messaging. There is the normal track that we go through the social workers with door-to-door activities, regular workshops on the ground, and so on, but also we do massive social media campaigns, massive campaigns on the ground, so that we can sometimes also aggregate certain topics together so we can target our beneficiaries. We believe that a change towards those social protection issues would help us to achieve a greater change, and as mentioned, the cash plus services. We are not only telling them about this is the right thing to do, this is the bad thing to do, but we're also directing them and helping them to achieve the different services provided by the Ministry of Social Solidarity. It's not fair for a family to tell them, for example, your child is having a certain type of a disability. Then what? We have to give them the direction, the hope, the way to go, what are the services provided by the government, how can they go about it, and how they can help their child. So this is what the program is trying to do. How are we going to follow up, and this is how are we going to assess our achievement of the ground? We are currently trying to establish what's called a social observatory within the Ministry of Social Solidarity, via which we will follow up with the families to measure what change we have been doing on the ground versus the different activities we are doing with them. It will take a lot of time and effort, and maybe we can benefit from what you were trying to explain about
the AI and using the causal inference. So this would be very important for us and will help us really in the work that we are doing. Thank you.
Thank you very much, Dr. Heba. Your first question is extremely important. What if the Kafala and Karama doesn't exist? What if there are other programs? Or what if it's simply directed to some specific services or specific needs, especially that the amount of money is actually very small. So we can certainly help with the social observatory and make the assessment. And it's good that you are starting, because this is where you can have a controlled group and another group and do comparisons. So we'll talk about that together, inshallah. Dr. Ahmed. Usually, I'm a ladies first. We start with ladies first, so now we finish.
Okay, so let me start by thanking Dr. Abla for the kind invitation and ECES. It's a pleasure to be here. And I'm going to start in English and then I'm going to switch to Arabic. So for Scott, thank you so much for your presentation. Actually, I believe it's extremely important to bring this type of topics, which might sound as super technical and super difficult, to the public debate and the discussion to people, because I believe actually it's extremely important for the public audience to learn about these different techniques and to understand what it takes actually to understand the like the impact evaluation of the different programs and why this is important. And thank you so much also for shedding light on the different techniques used there, including randomization, which is something I'm going to speak particularly about. So I'm going to switch to Arabic now. So maybe you need to switch off the microphone and go to the interpreter. Okay.
So I'm going to talk as I am the executive manager of Abdul Latif Jameel Association for Combating Poverty. This center, we are working as a research center in the USA, and the main idea about this is that we use the technique of the organized evaluation in order to have another evaluation of the programs in combating poverty. It started as an idea. The founders, they borrowed it from the medical sector. The idea is not new. The idea is if we would like to measure the impact of a specific program, we have two groups. A group that they are going to take, we implemented the program, and the other group we are not going to implement the program. What's common between the two groups is that the two groups are going to start at the same level. We can do variations to have more than one group. Some are going to take a cash transfer, another group they are going to take conditional cash transfer, and so on. And then we start measuring the impact. So this is the idea briefly. It's been 20 years that we are working in this field, and we are expanding and scaling up, like for example in the MENA region, in Egypt, we were transferred from just a small center in MIT to 7 regional centers all over the world among the MENA region and North Africa. And each center of this, we have a specific university. So in Egypt here, we are in the American University in Cairo. We are targeting combating poverty. And as you all know, that poverty, it has multi-dimensions. So for us, poverty, we have educational poverty, we have health poverty, we have the inequality, the gender inequality poverty. There are other issues that they are related to climate changes, and social protection is considered to be one of the main pillars that we work on, because for us it's very important to have to combat poverty and to take people out of the poverty sea. And we worked on 1,600 studies all over the world using this technique. This technique allows us to ask specific questions to know if this technique is working or not. I will implement the experiment on a pilot program, and then we're going to see the impact. In the social protection, we worked on many questions, and now I'm going to talk about I'm going to give some insights, and for me, it's actually saying questions more than giving answers. I'm not claiming that this is the only technique that can achieve our targets. For example, tackling the social protections, there are questions like, what shall I give the people? Shall I give them cash? Shall I give them in kind? Like goods, a cow, a productive asset, for example. What shall I give them? Or vouchers? What's the best model? This is among the questions that are asked. From among the questions also, the amount. Shall I give them takaful karama? She said, I was surprised about the amount that is given. If this is enough, I'll assume that the state or the government, the circumstances are very critical and very difficult, and we all know the circumstances. Is it correct to give every single person 700 Egyptian pounds, which is peanuts, or to give them services? I don't know what's better. We have questions and we are trying to answer these questions. What is the amount and the timing as well? Shall we make it conditional or non-conditional? Is it better to make it conditional or non-conditional? Shall we do it like takaful, education, vaccine, and so on, or to just leave it like that? Is the cost of monitoring if the families send their children to schools or not? I'm going to give you some insights on some of the answers, that most of these answers are not from our region. But in general, the answers are not coming from here, not from the MENA region. For example, the question of cash or in kind. We did not find an answer up till now, although that we conducted many studies in Mexico, Congo, Ecuador, and Indonesia. And I can give you how we conducted the studies, how the researchers conducted these studies. The study in Mexico, we focused on the rural areas. Some they gave cash to a group and in kind to other group. They found that the impact is equal. The only difference was when I give the groups in kind, like for example rice or whatever, that the prices are reduced in such areas. So there is a kind of a spillover that happened. I will not be able to support all the people, but if I am targeting reducing the prices, to give them in kind instead of cash. So these are some insights that can help us to a great extent. The same will apply on Congo, cash or vouchers. They found that voucher and cash, no difference at all. But the food consumption, actually the state focused on the calories intake. So the difference here will be on what is the aim and what's the context that we are tackling. So we are trying to answer these questions, and for us it can be a model that we might think about it. This is one of the questions. Actually, there is another question which is related to, if I give the people money, are they going to work or not? Always there is a concern in the public debate and in the parliament. Shall we give, when we give money to the people, they are not going to work? No, they are going to work. Don't worry. Can they buy temptation goods? No. When they got money, they will spend it on essential goods. The size, the amount of money. These a group of studies that are taking this into their consideration. We have some studies which is targeting a pool, focusing on the most poor families. The Chinese proverb that says, don't give the hungry person a fish, but learn him how to fish. So let's try a new model that we try to give the people a bundle of services, like a cow or whatever, in addition to training courses, in addition to specific transfers. And let's see this impact. We found that when they do these programs in this way, it actually helps a lot in reducing poverty. We implemented this in Upper Egypt. It was a pilot project in Upper Egypt by implementing such model that was implemented in 11 countries, and we tried to answer different questions. For example, what is the level? So the cost was I beg your pardon, to give you a production assets, and then I will see the impact on you. And another group, we reduced the cost by half. by 50%. I'm not going to give you the cost of a whole cow, but 50% of the cost. The two programs are working very well. So the idea of looking at how we are going to implement our project and how we are going to help the people. But I mean that we can use this in how to design programs to reduce poverty and to get out the circle of poverty. The idea of confidentiality, the condition and non-condition, is it better to design the programs as a condition cash transfer or not? All the studies showed that, and this is, we use the same technique, we saw that there is no difference at all between the conditional cash transfer and the non-conditional cash transfer. The two of them will achieve positive results, and that's actually happened in Morocco. In one of the studies that we conducted in Morocco, is that we don't do any conditional cash transfer, but we do a kind of a label. For example, this is cash transfer for education. No, I'm going to give you this money to educate your children. So they found that this has a very positive impact on the education outcomes. So we did the program randomly, a group of them. They told them, you have to send your children to school, and we are going to monitor. We are going to give you the support and the help to make sure that they go to school. And the other group, they said, we are not going to monitor, and this money is education support, and we are not going to follow up and monitoring. They found that the group that they said that they are not going to follow up with them, the results were better. If we are talking about saving from the point of view of the policy implementer, you removed the idea of monitoring and following up. I'm going to stop here. Thank you so much. Thank you, Dr. Ahmed. Very, very useful insights. If I gave wheat to the people, if I give them rice, so maybe the price of rice will be reduced. Maybe the results will be better. Dr. Hania would like to comment, and then we are going to open the floor for the questions. I'm not going to be lengthy. Dr. Ahmed said very important questions. What? To give the people rice, oil. But actually we give this, but this did not affect the price of the goods. Karama and takaful and karama, there is no conditionality. This is only words on papers. There is no follow-up. Do we have a calendar? Do we have follow-up? Anyone that goes and asks in the schools? I know that Nahla is here. There is a trial of following up, but we cannot look at Karama and Takaful from 2015 and to say that Takaful is conditional. It is not, because the medical health was not provided. No operation manual for the following up. So I cannot say that this is happening. As a designer of the program, I can tell you why these studies, these results are not implemented in Egypt. The condition was not there. The condition was to monitor the service provider. We are a centralized country. We have millions of children at schools. The idea of conditionality is not to impose on the poor people, to tell them go to school. This is the condition for the school. So the teacher will go to school to have an education system, and in order to ask for our rights. So when I go to the medical center, I want to get my vaccine. Vaccine in Egypt is very good, actually. So without being lengthy, I would like to tell you that in order to implement such questions and the kind of these questions that J-PAL asked, we need context. We need data. I need to dive into the details in order to answer the questions. The last point, does it impact the employment and the wages? Yes, I'm very familiar with the Mexican study that the minimum wage but they are not sensitive. there is a problem in the price of the goods, in the public services, in the labor and business market. So it's lots of things. Thank you so much, Dr. Hania, on your comment. We are going to open the floor for discussion.